What we're going to talk about today is fascial integrative therapy, which is what I do. It's a specialized type of soft tissue work working with the fascial system and the cranial system particularly, and bringing the body back into balance. I'm traditionally trained as an occupational therapist and as a massage therapist, and I've been doing this stuff for about 25 years now, so it's been out there for a little while. Beth knows. She's been with me for a long time. But what I do is I started working on doing the traditional things when I was in college, doing just your traditional OT things. And I was able to take a cadaver course when I was in college. And one of the things that we started out with in the first class was we had this body laying there, and they said, make your first incision. So I did, and I noticed that there was this kind of tough stuff that I couldn't quite cut through very well. And this was before I even heard the word fashion, so I didn't even know what it was. And I asked a question, you know, what is this stuff? And they said, oh, it's connective tissue, just cut through it. So I started cutting, and I'm realizing that as I'm getting into this and we're getting down into the body, this stuff is throughout the entire body. And interestingly enough, I am deathly afraid of spiders. And when I made this first cut and got in deeper, I saw this stuff that looked like a spider web, and I had this quick little panic that went through me like, oh my God, there's a spider in here. And interestingly enough, that's how the fascial system is described in a lot of ways, as an internal web. And as you get into it a little bit further, as I got into it a little bit further and was digging around in his body, I started realizing that that's exactly what it looks like. And it was pretty much minimized at that point in time. So, you know, I was in college and I'm listening to the doctors, and I thought, okay, fine, you know, whatever. And as I got out of school, when I graduated and started doing some of the traditional things and worked with a lot of different patients, I started thinking back on how tough that stuff was, and perhaps that's why some of these traditional techniques and some of the things that I'm doing and these other soft tissue techniques aren't quite working, that maybe there's something that's a little bit more to that white stuff or that web that I saw in there. So I started kind of doing my own research, and that's how I started getting into doing some training in the myofascial work, and then got involved with the cranial sacral system as well. And in my practice, what I find is that the cranial sacral system is technically the deepest level of the fascial system. And these two systems, what I do in fascial integrative therapy is to combine these two systems and working these two different techniques, working with these two systems together. Because what I found is that you can't really work one without the other, because they're essentially the core, the essence of what makes the body whole and what makes the body work. And at the risk of sounding like this is all snake oil, if you understand particularly what the fascial system is, again, it's like a web or a matrix or a network of tiny little tubes, little fluid-filled tubes that runs throughout your entire body, from the top of your head all the way down to the bottoms of your feet. And it's a, like I said, it's a multidimensional tissue, and it surrounds every cell in the body. When I lecture on a bigger scale, I have some slides that I use that show the fascial tissue that surrounds, it was taken from the electron microscope, that shows fascial tissue around brain cells. So if you're looking at something that has a tensile strength of 2,000 pounds of pressure per square inch, and it's about the consistency of a spider web, you're looking at some pretty strong forces acting on the body. And it being a multidimensional tissue in the way that it is, don't let me walk off. It's kind of like if you've ever seen a tensegrity model. The tensegrity model is what's used in a lot of engineering to put buildings and make certain buildings and bridges and stuff work, and that's how forces acting on each other. And it requires less building, so to speak, because you learn how to work the pieces to work together. And that's kind of how the fascial system works. It's what gives us our structure, and it gives us support. It's not muscle tissue, okay? It's an entirely different thing. And 99% of what you see out there as far as what's therapeutically being done and from a medical standpoint is all working on muscle tissue. 80% of what we call muscle tissue is actually fascial tissue in itself, okay? So again, the principles that you see that people use in a lot of traditional physical therapy and stuff is based on muscle. So you're technically only getting an effective treatment on about 20%. So what's happening with this other 80% that those traditional techniques don't work on? And that's why you see so many people that have been to therapy and they've gone and had all kinds of different injections and you name it, and they've gone from, you know, everybody and his brother. Nobody's addressing the fascial system. Nobody's addressing the fascial tissue. And the principles are based on a physics principle, and the techniques, excuse me, are based on a physics principle with light pressure, because you're actually changing the molecular structure of this tissue. It's almost like taking a solid to a liquid. It's not what you're doing exactly, but that's technically what it's doing. It's doing something more of changing the tissue. And if you try to force this tissue, which is what most therapies do, that's why you end up with more problems. So when you're not addressing the fascial tissue with people that have chronic pain, for example, most of the people in my practice, that's what I see. They show up and they have chronic pain. And they'll have a knee that hurts someplace and they've had everything under the sun, or back pain, or headaches, and they're wondering, well, you know, I've had injections, I've had pills, I've had this, I've had that, I've had everything under the sun, and it doesn't seem to be going away. And when they come in and we look at them and stand them up and take a look at them, and you see somebody standing there, hopefully that'll work, standing there, and they're standing like this, or they're standing with an upslip of the pelvis and their head's like this, and they say, yeah, I don't know why I have headaches. I'm like, I can't imagine why you would have a headache either, you know, let's see. And what's interesting to me is traditional medicine treats just segments of the body. We treat parts. You go in with a headache, what's the first thing they do is they treat your head. They don't look at the fact that you can't move your neck, and you're down, and your head is, you know, stuck down into your shoulders. And we wonder why you have shoulder problems when somebody is standing like this, okay? I see a lot of shoulder problems and a lot of frozen shoulders. A lot of people are misdiagnosed with a frozen shoulder, but they look right here, because the pain usually on a frozen shoulder, on typical shoulder injury or pain, is usually right here on the front part of the shoulder. Or they'll get a pain that runs down the back. The shoulder starts back here on at your scapula. Okay, this is actually where the shoulder starts. This is why they call it the whole shoulder girdle. And amazingly enough, if you've got somebody standing like this, for example, which is a very common posture, especially since we sit at computers like this so much, that tends to shut down this whole system. That closes down this whole thing. That shoulder problem is probably starting from right here at their pelvis. Okay? Because your pelvis is your foundation. Your pelvis is like the foundation on a house. All right? If this is crooked, just like on a house, if you build a house and the foundation sits like this, the doors aren't going to close real well, and you're going to have all kinds of problems with that. This is where you need to look first, and this is what we do in treating the whole body in fascial integrative therapy. It's an integration of all the systems and looking at the body as a whole. And again, in traditional medicine, typically we tend to look at body parts. If you have back pain, they go here. If you have a shoulder pain, they go here. And that might be the symptoms, but the cause is most likely elsewhere in the body, someplace else. And I see this all the time. I mean, the people in here that I know that I've worked on before, like you, and I see it all the time. And the first thing they do is, I had a guy that was in the other day, and he was in for shoulder pain. And the first thing I did was go into his pelvis, and this guy's looking at me like, you know, I guess you didn't take anatomy. This is my shoulder. This is not my shoulder. And I said that, and I kind of picked up on that because this guy was an engineer, and I kind of thought, okay, maybe I better explain this a little bit better. And I was explaining to him that the shoulder pain that he was having. Now, this is a guy who had had 7 injections in the last 2 months, I believe. They want to do shoulder surgery because they can't quite figure out what it is, so they want to do shoulder surgery on him. But they don't know why, but they're going to go do shoulder surgery. Pardon me? Yeah, let's go in there and dig around. Why not? Sounds good to me. Create some scar tissue. What the heck? Sounds like an idea. And I'm trying to think of what else he had. But anyway, he had been through the gambit. He had gone through all the traditional physical therapy I think he went through 3 rounds of physical therapy where they had him doing this, you know. And I thought, that's great, but if your shoulder can't move to begin with, you know, what exactly are you doing? And he was compensating and compromising the rest of his body, and his posture so bad that not one person, his shoulder was actually getting worse, and not one person ever looked at his pelvis. And when I stood him up, I said, let me explain to you what I'm doing here. Because again, and I think education's important, they need to know what's going on. he was standing, and it's his right shoulder. He was standing like this. And if you looked at him, he was standing and rotating completely like this. Not one person ever looked. And this whole thing was just, it's like somebody took that side and just crunched it. His shoulder, his scapula didn't move at all. It didn't glide at all. And every time he tried to move his arm above 90 degrees, this whole thing just locked down on him. And there was no way he could move it. So any of these nice little wall walks and all these things that he was doing and the injections, let's go in and inject this, none of that's going to be effective because that wasn't the problem. And I've seen him twice now, balanced his pelvis, freed up the tissue up in here that was bound down and not allowing his shoulder blade to slide, and he's pain-free. And I only saw him twice. And to me, that's not rocket science. To me, I look at it and I think, well, if you just look at the body, and we tend to look at the body in pieces, and in fascial integrative therapy, hence the name, I believe that the fascial system is that one forgotten system that nobody pays attention to. And I think that's predominantly what causes so many of the problems that we see out there that we aren't looking at. I have people with digestive problems. And they'll come in and I have a kid that is 9 years old that has been diagnosed with irritable bowel, and they want to give him steroids and put him on all these pain medications. 9 years old. And he's had these problems since he was, I think she said, his mom said since he was like 5 or 6. Okay? The kid stands like this. What do you think is going to happen here? Where is your gut? This whole thing is being compressed. He's crooked. So what I did is we just opened him up, and all of a sudden it's amazing how he's not having the kind of pain. He has more energy. He's not having the symptoms that he was normally having with irritable bowel. I keep forgetting. Don't let me forget. Just point me over. And it's all in, looking at what the body is, looking at the body as a whole, bringing the body back into balance. The way that I believe we do that is to look at the fascial system. And again, the fascial system is a tiny, tiny, tiny matrix of little tubes that runs throughout our entire body. It's very, very strong. And it's kind of like when you look at like a tent with a tent pole in the middle. The tent pole is not what's holding that tent up. It's the guy wires on either side of that. If one of those guy wires is pulling harder on one side than the other, that tent's not going to be straight and it's not going to be very sturdy. So if you just grab it, and it's going to pull the pole crooked. And in a lot of different things you see, the first thing people want to do is they want to go in there and they say, well, let's straighten that pole up. Okay? So let's force this pole to go over here and make it straight. Well, think about it. If you've got a tent pole and it's leaning this way, and you want it to be straight, so you force it over to get it straight, what have you just done? You've just created more tension on the guy wires on this side to where it was leaning in the first place. And that's what you see in a lot of therapies and a lot of different things that are done out there. We've now forced something to go back instead of looking at the body as a whole and bringing it back into balance. And same thing again is when you're looking at all of the rest of the systems in the body. If you have problems that are dealing with maybe the endocrine system, that could quite possibly be leading straight back to what's going on with the fascial tissue. If you have restrictions back here in the back of your neck, which a lot of people do right here at the base of the occiput, we have a lot of occipital headaches right up in through here. There's a lot of neurological structures that are all sitting right up in through here, okay? If you're not getting good, adequate blood supply and good exchange, where are the lymph nodes? You've got tons and tons and tons of lymph nodes and lymphatic flow up in here. If there's a restriction on them from a fascial restriction or just something that's being compressed where this lymphatic system is not working, it's not eliminating, it's not being able to get rid of the toxicity and the toxins that are in there, that's also going to inhibit the way that the whole lymphatic system is working. You're not getting rid of the toxins, they're staying in your body, and that's also going to inhibit the amount of T cell production that occurs in the lymphatic system. So if you start thinking about a compromised immune system, what kind of things do you start seeing with a compromised immune system? And you'll see people that will go and they'll try all these different things and they'll have everything in the world done for it and they have all these different supplements and medications. And I'm not criticizing them and saying they're bad. I'm just saying we need to step outside the box and look at the body as a whole and allow our body to heal itself. And look at it, what exactly are we doing to that and what is happening inside of our own body. When this is compressed, just as an example, and because I see this a lot in my practice, that's going to inhibit this. And a lot of the symptoms that we see, from pain to endocrine system problems, are stemming straight back to this. And once you get this opened up, it's amazing what starts to happen. All of these other symptoms and signs and stuff start to go away. So we have to look at the body as a whole. And that's, unfortunately, in a lot of medicine today, that's not what's being done. Knee pain. How many times do you see people standing, they lock their knees out because they don't have good core strength in here, and they stand like this? Are you laughing? Locking your knees out, all right? That completely and totally stops your knees from working the way they're supposed to work. And it shifts your weight to the front part of your feet for the most part. How many people have bunions? Okay? If I'm standing locking my knees out, the weight's being shoved backwards. So my body's got to compensate some way or another, so it leans forward, and now my weight is on the balls. My knees are locked out even more, and the weight's going right here on the ball of my foot. All right? Most likely it's going right here on that front part of that first metatarsal. And we wonder why that starts to spread. It's just like anything else. It's trying to get a wider base of support. The toes starts to turn this way, because that's just the natural process of the mechanics of the body, and now you have a bunion. So you go to the podiatrist, he says, well, we got to do bunion surgery, we're going to cut a piece of bone out of there, and we're going to bring that back. But you haven't changed any of the rest of the mechanics of the body. So now you've got a surgical foot, but you haven't changed what actually caused it to begin with. When in all actuality, by bringing the pelvis back, balancing the pelvis over the hips where it should be, relaxes the knees, takes the pressure off the foot, and the bunions will go away. You have to do some little mechanical things with it sometimes, but it goes away. So we need to start looking at what are we doing, what's the whole body doing, what is our entire body doing. TMJ problems. I see TMJ problems all the time. People with a forward head, that shoves the jaw forward. And they go in and have these implants and have these things put in their mouth, but your jaw's forward. Okay? If your jaw is forward like this, there's no way that you can get anything mechanically to go in there that's going to sit appropriately and work. And what they've done is put these appliances in there that are forcing it back, but the head's still forward. So you haven't changed the mechanics of it. Unfortunately, just being told to bring your head back doesn't work, because if you've had a position like this, think about it. Somebody with a forward head, most of the time with somebody with TMJ problems, again, I go straight to their pelvis because they're standing like this. I have to balance this back in order to open this up in order to allow the jaw to come back. Then I can do the soft tissue work to release the tissue in there that's being restricted now because of the position it's been in for so long. So I think looking at the body as a whole, we need to look at all the pieces. I have people that have been diabetic, borderline diabetic. I have this all the time, and I didn't realize how frequent it was until I started just really noticing. I was seeing a lot more and more people that were being diagnosed with borderline diabetic. Well, if you've got a forward head and you've got a position, a compromised position, some way, shape, or form, or something's happening where it's tight, you're slowing down the craniosacral rhythm in the body. And the craniosacral rhythm is another system in the body that's actually the deepest level of the fascial system. And it's an ebb and flow of fluid through our body. That is a vital fluid that starts in the third ventricle of the brain and is produced and shoved all the way through, helping what develops the blood. Okay? If you don't have good, strong, healthy blood, what's going to happen? You're not going to supply the whole rest of the body with the nutrients that it needs to do that. Okay? So you've got this system that is shut down, that's not working, so you're not getting good, adequate blood flow and good, nutritious blood to the rest of the body, so you can just imagine what you're setting up with that. At the same time, when this system gets shut down, when I say your system, I'm talking about the cranial bones. You're standing like this, that's like putting a vice on that. There's a little gland in your head, and it sits right down through here like a cherry on a stem. It's called the pituitary. It's the master gland of the body in the endocrine system. It's the one that triggers all the rest of everything to do what it's supposed to do. The way that thing starts to do its job is there's a bone in here that kind of looks like a butterfly. And if you could like take the front part of your head off, you'd see it. It's like right in there. It sits straight down in through here like this, kind of shaped like a butterfly. And it rocks. Rocks along with the ebb and flow of the craniosacral system. that milking action or that rocking action produces a milking action to the pituitary gland, which stimulates the pituitary gland to do what it's supposed to do to trigger all the rest of the glands in the body. One of the glands in the body that works on people with insulin dependency or diabetics starts there, and it's this whole endocrine system. And when you see people that are they're all over the place with diabetics, they have trouble getting, 1 minute they're too high, the next minute they're too low. 90% of them are tight, right up in through here. They're stuck right in back through here. So again, if we're not looking at all of the pieces of the body and we're not looking at all what's happening, we don't understand the fascial tissue, and it's the fascial system that is a great thing in our body. It gives us support and strength to the muscle and everything else. But if we're not looking at it as a whole, then and realizing what kind of problems can be occurred by looking at the whole body, then we're missing a piece. We're missing this whole thing. Okay, I'm getting told it's 5 minutes. Does anybody have any questions or comments or anything? Yes, ma'am.
Is it like lower back pain? Is that caused also from the...
Lower back pain can be. Low back pain can be. Most of the time you see people with low back pain, it's a postural thing. And they want to go in and they go to physical therapy, and some of my best friends are physical therapists, so please don't take it. Like I said, I'm traditionally trained as an OT, and I don't mean it like that. I just know what I've seen out there because I've done it. I worked at a pain clinic. And they tell you to stretch. Well, they're giving you stretches to do for muscle. And it isn't that those aren't good, but you're not addressing the fascial tissue that needs to be released, and you can't stretch the fascial tissue by holding it for 20 seconds. It doesn't work that way. And you've got to look at what is causing this low back pain, because a lot of people with low back pain, they are so compressed that their body can't move, their hips can't move, you don't have good rotation, and all that stuff just starts to lock down. Now, aside from maybe if there was an accident and a disc problem, but think about it. If you've got a disc in there and you've got compression on that disc, it's just squeezing it, all right? So, and every time you move, you're actually forcing your body to try to do something. All right, if it's tight and you're trying to get it to move and bend and it doesn't want to, you're actually forcing it. You're trying to create something and forcing something to happen as opposed to allowing it to glide and move nicely. I work on people with back pain all the time, and I work on their whole body. I might work up here on their neck, or I might be working on their hamstrings and working on different pieces of it because the symptom is probably right there at their low back. Visual disturbances. I have people with visual and hearing problems all the time. And usually what's happening is it's like somebody put their whole body in a vise. And you start to free those up. If you think about how your ears work, sound has to come in and vibrate on little bones that are in there that have to move. If they're not moving and that isn't happening, something's going to give. Unfortunately. So then they go get all these other things happening in their ears, and they wonder why they can't, what's the hearing problem. Start doing some cranial work on them, balancing them and freeing their body up so that it can move correctly. And they're like, I can hear things I couldn't hear before. Okay? So I think what we need to do is just really start looking at what else is out there. What are we not looking at? Which is looking at the body as a whole and looking at the body, the fascial system. Did that answer your question? Sort of? Kind of?
Are there any books or anything that you would recommend as far as linking these symptoms to different causes that you might not realize?
Well, actually, it's interesting you say that, and this is not a pitch, I promise, but there isn't. There are some things out there, but there isn't. There really isn't anything out there. We're actually in the process of doing a book right now so that they can get some of that stuff out there, but I looked, and that's how I got, because I am not a writer, trust me, and that's how I got conned into doing this in a way. It was because there was nothing out there. There's not really many books out there that pull all the pieces together. There really aren't. Unless somebody knows of something. If somebody knows something, tell me. I know there's some really good books out there, but I'm not finding one that's pulling all the pieces together and talks about these things. They talk about them in pieces, but they don't talk about them as a whole. You have shoulder pain because, something else is off. So, unfortunately, I haven't seen anything.
Have you ever treated neuropathy?
Mm-hmm.
Have you seen any success with that?
Absolutely, it depends, and it's different because there's different things, there's different causes of it. But yeah, most of the time, if you can, it's the same thing. You bring in, they don't know why it's causing it, and you bring them in, and these people can't move. They're stuck. They're bound down. It could be something that's, they could have a spot in their in the spinal column. Could be something in the whole dural tube that's it's the covering around the brain and spinal cord, because you're right there at your central nervous system, and you're getting into the peripheral neuropathies, but it's got to start somewhere. And what they do is they treat peripherally. And that may not necessarily be the problem. Or it could be the problem, and it's just like, again, it's like somebody squeezing a sponge. You got to take those pressures off so that the body can do what it needs to do and function correctly. So yeah, I see a lot of that. There's a lot of different things you can do with that. And sometimes it is, I do a lot of cranial work on those guys too, because again, it goes back to the endocrine system and some of the other neurological structures. And it starts up, I'm working on their head, and they've got peripheral neuropathies, and I'm working on their head. So I appreciate you listening.